In our series Medical Price Roulette, we're investigating the lack of transparency in medical pricing in collaboration with the journalism company Clear Health Costs. There is a recent study that found nearly 1 in 8 people with commercial insurance who had a screening colonoscopy were hit with hundreds or even thousands of dollars in unexpected charges. Now, there is new legislation signed by President Trump that may resolve the problem for Medicare patients. But a lot of our viewers with private health insurance tell us they've been stuck with such bills and simply cannot understand why. Consumer investigative correspondent Anna Werner has been digging into this. Anna, this is so interesting. Good morning.
Good morning, David. You know, everyone over 50 should get a baseline screening colonoscopy, and federal guidelines say insurance companies should pay for it. So why do we keep hearing from viewers who say they got stuck with the bill?
Tammy Garisi Duncan turned 50 in January, and along with her birthday came an order from her doctor for her first screening colonoscopy, recommended for everyone turning 50 and supposed to be given at no cost to patients once every 10 years under the Affordable Care Act. She called her insurance company to confirm they'd pay.
And what response back did you get from Blue Cross Blue Shield?
The procedure was 100% covered as a screening. The facility was 100% covered, and the doctor was 100% covered, all within network.
At the clinic, she says, a staff member asked if any family members had had colonoscopies, which they had.
I said, well, my mom had a few polyps back years ago. My dad had a few polyps.
After the test, she says, the doctor told her everything looked good.
And that was it. And when I went home, everything was well, and then I started getting the bills.
And those bills for a colonoscopy that was supposed to be covered? Some $625 for the facility, over $300 for the doctor's services, and another $325 for the anesthesiologist. In total, over $1,200 her insurance company refused to pay. The reason? She says the clinic had decided that because of her parents' polyps, she was now a high-risk patient. So then her insurance company said it was no longer a free screening colonoscopy, but a diagnostic colonoscopy she'd have to pay for.
I said, am I on candid camera somewhere? I don't understand this at all. It seems utterly ridiculous. And I just wonder how many people this is happening to, which is why I contacted CBS when I heard about, kind of the unveiling of this type of problem.
She's not the only one who's contacted us. We've had dozens of complaints from people who say their free screening colonoscopies turned into large, unexpected bills, particularly if they had precancerous polyps removed, an integral part of those screenings.
Colorectal cancer is the second leading cause of cancer deaths in America.
New Jersey Democratic Congressman Donald Payne Jr. has been trying to fix those billing issues. His father, longtime Congressman Donald Payne Sr., died of colon cancer in 2012.
Unfortunately, my father would not get checked and subsequently succumbed to the disease. And there's no reason that he shouldn't be here now other than he wasn't screened.
Payne sponsored legislation to close the billing loophole for Medicare patients so that if polyps are removed, that part of the colonoscopy will also be paid for.
People should not have to be worried if and when they go to sleep for a procedure, what the bill is going to be on the other side.
His bill passed Congress last week, but it doesn't apply to private insurance patients, many of whom told us they still received bills for colonoscopies they thought were covered. That's despite the fact the Department of Health and Human Services says screening colonoscopies should be covered for private insurance patients, even if polyps are removed.
Is this the way you wanted it to work?
No, and that patient who goes into an office to get a screening colonoscopy should not have to pay anything when they wake up.
Dr. Mark Fendrick is a professor of medicine and public health at the University of Michigan, who helped write that section of the ACA.
The fact that you're still getting your viewers sending in these complaints suggests we have not implemented what I believe is the spirit of the regulation.
Dr. Fendrick says the ultimate goal should be for the entire screening process to be covered for everyone. But in the meantime, Garisi Duncan still owes over $1,200, a debt she says she has no plans to pay.
I've already instructed my family members, if I were to die, unfortunately, in some tragic accident, do not pay this bill.
Well, she has an appeal pending with her insurance company, Blue Cross Blue Shield of Illinois. The company would not comment on her individual case, but told us that doctors are the ones who code the colonoscopies as either a routine-free screening or a diagnostic colonoscopy. If it's a routine screening, they said that they are free to members if they are in network. Now, if you have private insurance and you had problems with this or any other medical pricing problem out there, we'd like to hear from you. You can email me at healthcosts@cbsnews.com. Tarika?
Anna, thank you so much.